100 points you need to know about Alzheimer's disease. Alzheimer's disease is a progressive neurological disorder that leads to the decline of memory, cognitive abilities, and behavior. It is the most common cause of dementia affecting millions worldwide. Alzheimer's primarily affects people over the age of 65, but early onset can occur in people as young as 30 or 40. Symptoms start mildly but worsen over time, interfering with daily tasks and independence. Initial signs include difficulty remembering recent events, names, and conversations. As it progresses, people experience confusion about time and place. Individuals may forget familiar faces, locations, and personal information. Cognitive decline includes challenges in planning, solving problems, and following instructions. Language abilities can be affected, leading to trouble finding the right words or joining conversations. People with Alzheimer's may misplace items frequently and accuse others of stealing. Visual and spatial difficulties can develop, impacting activities like driving. Alzheimer's often leads to changes in mood and personality, such as anxiety, suspicion, and depression. Social withdrawal is common due to embarrassment, frustration, and confusion. Advanced stages bring a loss of bodily functions such as bladder and bowel control. Alzheimer's patients often require full-time care as independence diminishes. Daily life example and becomes lost on a familiar route home. Another example, difficulty in remembering the names of close family members. Causes are not fully understood but involve genetic, environmental, and lifestyle factors. Brain changes include amyloid plaques and neurofibrillary tangles, damaging neurons. Alzheimer's is linked to a deficiency in acetylcholine, a neurotransmitter crucial for memory. Risk factors include aging, family history, head trauma, high blood pressure, and poor heart health. Early diagnosis is critical but challenging due to overlapping symptoms with normal aging. Alzheimer's is diagnosed through cognitive tests, physical exams, and brain imaging. There is no cure, but treatments aim to manage symptoms and improve quality of life. Medications like donepezil, rivastigmine, and galantamine can slow symptom progression. Memantine may help improve cognition and delay functional decline in moderate to severe cases. Antidepressants and antipsychotic medications may be used to manage mood changes and agitations. Cognitive stimulation therapies can help maintain cognitive abilities for longer. Regular exercise is beneficial for maintaining physical and cognitive health. Maintaining a heart-healthy diet, such as the Mediterranean diet, is recommended. Sleep plays a critical role in brain health. Poor sleep can worsen symptoms. Social interactions and engaging activities may delay cognitive decline. Speech therapy can help manage language difficulties. Occupational therapy can assist in maintaining daily living skills. Art therapy may reduce anxiety and improve mood in patients. Caregivers play an essential role in providing support and assistance. Caregiving can be physically and emotionally challenging but requires planning. Support groups and resources are available for families and caregivers. Legal and financial planning is essential as the disease progresses. Advanced care planning, including end-of-life decisions, is necessary. Clinical trials are ongoing to find potential treatments and better understand the disease. Experimental therapies are exploring the potential of targeting amyloid plaques. Lifestyle choices such as regular physical activity and mental stimulation may reduce risk. Alzheimer's significantly impacts the patient's quality of life and that of family members. Emotional support is vital for both the patient and the caregiver. Researchers are studying genetics to understand hereditary risk factors better. The disease progresses over several years and the rate varies among individuals. Alzheimer's disease often causes additional health complications like infections. Preventive measures are not guaranteed but include heart-healthy habits. Alzheimer's has a significant impact on healthcare systems and costs. More than one type of dementia exists. Alzheimer's is the most common. Dementia can coexist with other conditions, complicating diagnosis and treatment. The early stage lasts about 2 to 4 years and involves mild symptoms. The middle stage can last several years and involves greater cognitive and physical decline. The late stage requires intensive care, often with limited communication abilities. Brain imaging shows shrinkage in areas related to memory, like the hippocampus. Plaques and tangles can start developing 20 years before symptoms appear. Alzheimer's affects reasoning, judgment, and decision-making abilities. Behavioral symptoms include agitations, wandering, and aggression. Wandering can be dangerous, leading to injuries or getting lost. Infections, like pneumonia, are common in the late stages and can be fatal. Alzheimer's increase the risk of falls due to poor balance and motor skills. Some patients experience hallucinations or delusions in advanced stages. Daily routines are essential to help reduce confusion and anxiety. Alzheimer's patients often rely on family members for companionship and assistance. Specialized facilities such as memory care units cater to advanced dementia needs. Legal aspects include power of attorney and guardianship for decision-making. Cognitive symptoms are irreversible, as current treatments cannot restore lost function. Alzheimer's causes progressive brain cell death, leading to brain atrophy. Supportive therapies, such as reminiscence therapy, involve discussing past memories. Some patients may require assistive devices like walkers to prevent falls. Pets can have a calming effect on people with Alzheimer's, reducing stress. Caregivers need to respite to prevent burnout, which is common in long-term care. Financial costs for care can be substantial and increase with disease progression. Family dynamics often change as relatives adjust to caregiving roles. Advanced Alzheimer's can lead to difficulties in swallowing and eating. Loss of sense of time and place is a hallmark of the disease. Public awareness and research funding are increasing for Alzheimer's disease. Governments and organizations promote Alzheimer's research and support resources. Research includes studying how inflammation may contribute to Alzheimer's. MRI and PET scans are used in diagnosis to monitor brain changes. Annual checkups can aid in early detections for at-risk individuals. Brain stimulation techniques are being investigated for the therapeutic effects. Genetic testing may reveal hereditary risk but is not definitive. Exercise may release chemicals that support brain health and resilience. Vitamins such as vitamin E are studied for potential benefits but are inconclusive. Some studies suggest a link between mental stimulation and delayed onset. Cardiovascular health is linked to brain health. Managing hypertension is crucial. Loneliness and depression may increase Alzheimer's risk and progression. Older adults are advised to maintain mental, social, and physical activities. Caregivers should monitor for depression, which is common in Alzheimer's patients. Cognitive exercises like puzzles may help sustain mental abilities in early stages. Aromatherapy with scents like lavender may improve relaxation. Visual cues like signs or labels help reduce confusion at home. Specialized clocks or calendars may assist with time orientation. Safety modifications like removing hazards reduce fall risks. The use of smartphones or tablets may help patients with reminders. Nutrition plans are adjusted for those with swallowing difficulties. The late stage of Alzheimer's often leads to complete dependence of caregivers. Alzheimer's awareness campaigns highlight early signs for timely interventions.